It is my pleasure to introduce to you Keith Thompson from the local Social Security office. He's the Regional Public Affairs Specialist. So go ahead, Keith. Thank you for joining us.
Thank you for having me. This has been great to just learn more about the organization and to have the opportunity to talk about Social Security. I know we never answer all the questions that you may have. The presentation that I have today is directed generally for pre-retirement, but many of you may have already retired or you have questions about your situation or for others. And so feel free, I'll go through the general information to hopefully answer your questions, but we'll have some time afterward. And if I can't answer your question, I can always follow up with you. I'll try to do my best to just really explain the program, how it works, and in doing that, hopefully be able to answer all your questions today. So, and thank you for the invitation. It's especially in these days with us all staying home, we've been doing a lot more meetings online, and it takes a to still connect with people. So Social Security, a little bit about me. I worked in Social Security in the Richmond office and for about 17 years. This year is my 17th year. I've held different jobs, but as outreach, we get to go out and really hear from the public on what is, what Social Security means for them. So we tailor our presentations because there's so much information. We tailor and customize it for each audience. So I'm going to talk a little bit about how Social Security is with you through life's journey. And what I want to mainly talk about is just Social Security benefits, retirement benefits in particular. We will touch on spousal benefits and all how it's calculated. And then I want to talk a little bit about what else affects your benefits. So if you're all federal employees, it's important you started your service with federal government and the type of pension that you chose, you may have a different relationship with Social Security. And then of course, Medicare is our biggest question and concern. We answer a little bit about Medicare. I'm not the, our Social Security's role is unique in that we managed all the premiums and payments and the enrollment for Medicare, but actually we have to work with Medicare specifically for the day-to-day operations. Lastly, I want to make sure that I promote everything that you can do online. Each of us are learning more than ever now how to access, how to shop online, how to access programs. Well, Social Security is doing everything we can to make sure that all our programs and services are available online. And it starts with a My Social Security account. So hopefully I can encourage you by the end of this presentation that you'll each have your Social Security account, and I'll talk a bit about the benefits of having that account. All right, so before we get too deep into the conversation, generally I can ask everyone to raise their hand in a presentation and say, have you received a phone scam alert call? And everyone raises their hand. And unfortunately, I start this presentation with that announcement just to let you know that we are aware of all of the telephone scams. Unfortunately, it's not just our agency, it's IRS, DMV, especially with the economic impact payments, the payments that people were receiving for coronavirus. Our advice is to hang up when you receive these calls. Do not give anyone money or any of your personal information. And specifically for Social Security, we want you to report them to this website, oigssa.gov. We've actually received so many that they had to, they no longer publish the phone number because they were getting so many calls. And so we're encouraging people to let us know. If you don't want to do the internet, you can always let us know and we can report it for you. But it does help to track down the fraudsters. We get regular reports about every couple of months about what type of like who's committing this fraud, how they're catching them, just so that we can have a sense of like, are they doing anything? And there's a couple of other tips on that website if you go, that you can block your phone number so that you're not, to make it so it's less frequent that you receive those calls. So I like to start with that because I want to make sure that when we do call, you actually do trust us. All right. So Social Security is a whole lot more than the card. For most of us, at birth, you're assigned a Social Security number and you can get that card right then and there. But we do more than that. Social Security actually tracks earnings throughout someone's life. And so that's kind of how it was established. But we want to talk a little bit about, all of the other aspects. There's a lot of life changes that a regular individual would have that you may not think of Social Security that were there for you during that time. And so often people think of Social Security later on during their retirement, but we try to remind everyone that we're there throughout that entire process. So I want to start with the beginning. Back in 1935, President Roosevelt signed the Social Security Act. It's been over 85 years this year. And it was initially designed to pay workers that are 65 and older. Now, many of you know that we actually pay the gamut now. There are people who may have a disability earlier on in their work career, and they're entitled to Social Security. That's at any age. People have spouses, people have children that are under 18. If they're eligible, they can also receive benefits. Now, there are a couple of other programs that we manage, SSI and survivor's benefits. It's important to know the difference. A lot of times I talk to people and they just know that they get a check. They don't necessarily know who it's from. So I'm glad that we're doing this call today. Most of you sound like receiving your Social Security income, but you can help us know where they can go to make sure that they know what type of benefit they're getting. And just like to add that Social Security is the most successful anti-poverty program in history. In the news right now, there is, since September 1st, there is a payroll deferral, the deferral tax that they've enacted between now, September 1st and December, to allow for workers who are making less than, I think it's 104,000. They're not going to take those taxes out. And the reason I bring that up is this is kind of the core of how we're funded. So I'll go into a little bit because we often get questions on how that's going to actually impact us. But before I do that, I want to talk a little bit about, like I said, Social Security is really only about a 40% replacement of your earnings. A lot of people feel as though it's this account that they've been paying into because you're working, and they see that money is coming out of your account, out of your paycheck, that it goes to like an individualized account. Well, it's actually insurance, and based upon your entitlement and your family situation, your makeup, you will get a percentage of that based upon your situation. So Social Security generally is about 40% of your earnings. And that's why it's best to partner with your pension, any other savings and investments, and other income. And let me talk a little bit, because for federal employees, if you worked for the federal government in 1983 or earlier, you probably did not pay Social Security taxes. You will have a civil service retirement system. I know we received a question about that. So if anyone is in that, they didn't pay into Social Security. Now, you did pay for Medicare, so you're entitled to Medicare, but you didn't pay into Social Security. Depending on your full work history, if you had other points, and we're going to talk about credits towards Social Security, you still could be entitled to receive some benefits. But there is an offset that we do, and it can become a complicated formula. And so I want to talk a little bit about the general formula. And then if you have specific questions about your scenario, we can talk further offline, or I can show you some calculators of where you can figure out why they adjust the way that they do. We get a lot of questions, and generally it's based upon a government pension offset for those who didn't pay into Social Security. The way the formula, it's made to adjust for certain income. So if you're a higher income worker, a earner, you're gonna generally get less back in your social earner. You're gonna get a little bit higher. So what happens if you don't pay into Social Security, but you're a high income earner? The formula that we use needs to be modified to adjust, for the people that didn't pay into Social Security. But we'll go a little bit into that a little later. So who pays for Social Security? Let's jump right into that. So I already talked a little bit about the FICA taxes that comes out of everyone's the check when if you are paying into Social Security. And this slide shows that one credit, and this is for 2020, one credit is $1,410. So if you earn up to $1,410 in the year, you get one credit. If you can earn up to 4 credits in 1 year. So if you earn at least $5,640 in that year, you'll get the 4 credits. So 4 credits per year, and 40 credits are essential to meet the basic requirements for retirement and for Medicare. So always remember that, it's the 40 credits. So for instance, if you worked at a job, and it can get complicated. Let's say if you worked for a job that didn't pay into Social Security, you can be earning, but you're not paying into, you don't have credits that are covered by Social Security. So that we'll have a modified formula to figure out your benefits. And that's why it can get complicated if you have a lot, specifically government jobs. We do this presentation for city and state employees, and often they don't pay into it, but maybe they have 10 or 15 years where they did work and they have Social Security. So they're somewhat eligible, but they didn't, a lot of their years aren't covered. And so we have to modify those earnings in order to get the right amount. Hopefully that makes sense. And we can ask any questions in the chat and I can follow up. So FICA, so who pays that? So the total FICA is 15.3%. So that's usually your employer pays half of that, 6.2% for Social Security and 1.45% for Medicare. And then the employee pays the other side of that. So right now what's happening with the deferred FICA tax, basically the portion, the employer portion they're not going to withhold that. So, but the employee is going to have to pay that later. So there's still a lot of questions about, kind of the purpose of that, but that's what they're doing. So you can see the 6.2 is for Social Security tax, and that's mirrored with the employee and the employer, and then also the Medicare tax. So this is a shared contribution that goes into the trust fund. We often hear about. So everyone that's working today is paying into the funds for those that are receiving benefits today. So it's not that I'm paying for something that I'm going to get later. I'm hoping it's a trust that we're paying for the future. And often people forget this part of it. And this is just another example of showing how that the estimated 175 million workers today that are covered by Social Security, that 6.2 of their wages and 1.45 towards Medicare, that's going to pay all the people that you see underneath the umbrella today. So the workers that are working today are paying for those who are already receiving benefits. And I really can't stress that enough, that it's not some separate thing that you've paid into individually. It's really this relationship that we have with the future. Okay, so here's a little bit about the formula, how we look at the formula. So on the far right, it's kind of blurry, but it's a printout of a benefit calculation. It's an example of someone retiring this year with all of their employment history. So if you could see that, it would show the year, the amount that someone made, the index factor, which is really important, and then the actual index earnings. And what we do is we look at the average index monthly earnings, and we determine that amount. And we have to, you know, in order to do that, we look at all of the earnings for the 35 years, the top 35 years. And this is important to stress because everyone may not work 35 years. You only need 10 years to be, you know, to be eligible for Social Security. So you can still receive a check, but we still look at the top 35 years in order to get the aim, which means if you have 10, 20 years with zeros in them, because you didn't work those years, you would still get a check, but we're averaging in those zeros. And this is why if you don't pay into Social Security, but you actually have other earnings, why the formula is skewed for federal, for folks who've received a federal pension or something, because there's no way for us to calculate that those earnings because you hadn't paid into that, so it doesn't get captured here. So it's important for us to have a modified formula, and I'll show you where the modifications are. So here it shows, so based upon this example, and this is just for an example, we created one where the aim in this person's example is a high earner is $6,000. That's their average index monthly earnings, 6,000. So we would take the first 90% of that, which the 90% of the first 64. We would take 32% of the next 4825, and then that's 1544. Anything over that is we take 15% of whatever's, and in this example, there's a few dollars, so that's $32. So 15% of each one, and you take the calculation of each one, you add it up, and your total, this is how we figure out the monthly benefit amount. So for those who did not pay into Social Security, we use another formula. If it's just zero, instead of 90% of the first 960, we would take 40% of that 960. And that number varies depending on how many years of service that you have. And that's why it can become very confusing. But that's the only change. Instead of the 90% of the first, big chunk of money that we look at, that amount changes. And so, but once you kind of get an understanding of, we look at the full 35 years, we index each year. So we may go back to 1980 and say, well, actually we need to, show inflation. So we have this index amount, we multiply that to find out what the actual index earnings are. Once we figure all of that, then we can actually get this average monthly earnings amount to determine the monthly benefit. Okay. There. So everyone in the past, we used to send this out about every couple months before your birthday. You would receive a Social Security statement. The statement includes all the information I just shared. On a regular basis, it will show you what your retirement earnings would be, your disability, your family survivor. This is all prior to you receiving benefits. So this statement will give you an estimate up before your full retirement date at a regular basis. And it shows your earnings record. It's really important to look at this document on a regular basis to make sure it's accurate, because this is the information that we use to come up with the formula. If it's not accurate, then we're not going to get an accurate amount. And this statement you can actually access online through the My Social Security account that I talked about. So I'll talk a little bit about full retirement age. Now, when I was growing up, 65, that was the magic number across the board for everyone. But back in 1983, I believe, I think it was 83, we made changes, Congress made changes, because we were looking at the trust fund in general, and we said, hey, people are living longer. We need to extend the retirement age. So what happened, they made changes so that if you're born from 43 to 1954, so it's not everyone at 65, it's 66, and then a couple of months for each one. And then someone like me is going to be at 67 years. If I'm born after 1960, now my full retirement age is 67. So now the earliest retirement age is still 62. That has not changed. So for those who want to begin applying for retirement as soon as if you're eligible, if you paid into the benefit, the earliest that you can retire is at 62. And as you see in this example, it shows about 75% of your benefit amount. So there is a reduction. And people ask a lot about, well, should they wait, or should they take it early? There's no guarantee. These are all questions that you have to decide. We can basically bring the information to you. We can't tell you what to do, but it's important to look at your own situation. If you do wait, as you see, your full retirement age, you'll get 100%. There are those who will wait all the way up to age 70, and that's the highest age that we'll continue to build your benefit amount. And so you can get almost 130% of what you would have been entitled to. And so these are just different considerations. But if you wait until 70, you also have to remember for all of those years between 62 and 70 that you receive any check. If you receive 75% of a check before then, that's almost 8 years of receiving benefits before you turn 80 years old. So those are, or 70 years old. So those are the different things to consider. And this is just a different breakdown of that retirement. So you can see the scale. It's like 25% for 60, if you're 66 at 1954 versus someone like me is the 30% difference because it takes a little longer for me to get full retirement age. And these are the same for spouses. Oh, let me go back. See someone taking a picture. And I think we'll have the presentation where you can share this too. And I jump right into this because many people continue to work even when they become first eligible, depending on their full retirement age. So you can still receive benefits, but what we do is we will withhold a certain amount. So for 2020, so these annual limits change every year. So you have to look at what the annual limit is for that current year that you choose to retire. So let's say if it's for 2020, it's $18,240. So $1 for every $2 that you've earned, we will withhold that. If you decide to go in for, decide to apply for retirement benefits and you're under full retirement, let's say 28,240. So for that 10,000, basically they're going to withhold $1 for every $2 made. So that's half of that. 5,000. They're going to withhold that money from my retirement. So the year, let's say I turned 66 in 2020. So that is the year that I'm full retirement age. Well, that annual limit is higher. So we don't start to withdraw any money or any penalties after 48,600. And then it's also $1 for every $3 earned. So it's a little bit different for the year that you are full retirement age. So that's just know that if you continue to work and you're eligible for receiving benefits, there is a penalty if you decide to receive those benefits. And the on retirement or if you are in the year of your full time. After that, after your full retirement age, there aren't any penalties.
Okay, somebody asked if you could go back one slide.
Okay.
I don't know if they needed, yeah. Okay, thanks. Yeah,
this one is tricky. It took me a while when I looked at it, I said, oh, well, I get it now. If for someone who the reduction is larger for someone who has to wait longer, basically. So at 62 for me, that's between 62 and 70 or 7, that's 5 years that I now need that reduction factor between 60 to 66. So that's the difference because we've changed the reduction rates. The reduction rates are based upon someone's date of birth. So hopefully that explains. And you can look at on several calculators that we'll talk about that you can put in your own information, your own scenarios. And that's why it's really important to do the My Social Security count. So for taxes, it does get a little tricky, but if you file as an individual federal tax return, we look at your combined income, and on the next slide, I'll show you how we calculate that. But if you earn between 25 and 34,000, you may have to pay income taxes on a percent of, let's see the slide there. I think it's 50% of your benefits. And then if it's 34,000 up, it's 85%. And so you see the different categories there. If you file a joint return with your spouse, or if you file married and separate, there's different impact on that. And basically, this is how we look at adjusted gross income plus any non-taxable interest, and then half of your Social Security benefits. And that's how we calculate the combined income. So yeah, you literally have to, I've worked with people where you have to just write it out and figure out how so that, if you want to expect, and that's why a lot of times people work with their financial planner on getting all that information. And that's why I generally stop there and on the online calculators, because we have the web. So there was a question earlier about someone who may be experiencing the windfall elimination provision. There's a special calculator that you can put in what your pension amount or your spouse's pension amount and how that can impact your Social Security benefits. And you can calculate that on the web calculator. There's the early or late. So you can look at whether you retire at 62 or you wait until 68 or whatever, and you see what your benefits would be during those times. You can also look at the GPO that helps you look at a spouse. So I think I'll talk a little bit about how spouses are generally, for the most part, entitled to 50% of the number holders amount. But what they do, they'll look at, because you can have a spouse that is also working and almost makes the same amount of money, what have you, that they look at whatever is the highest. So if my spouse, if what they would receive, if their own record is higher, they're only going to receive what's on their record. But they're entitled to 50% what's on my record. So they will look at both. And so, because you have to remember, spouses benefits was designed for folks who maybe did not have their own income. That's generally where the program came from, so that if I had a spouse, they would make sure that that person was protected. They would have 50% of my earnings. But if they have their own earnings, and if their own earnings are more than my 50% of what they would have been entitled to, then they will only receive that, not both. I just want to clear that up, because sometimes people think that you get both. It's just one or the other. And then that's the same with widows benefits. What's that? So widows benefits of that person typically can receive 100% of what the number holder would have received. And so it's good to know the difference between that, and that can make a big difference, whether it's half of what someone's received or 100%. So that goes the same for divorced spouses as well. And a divorced spouse can be on the record even if the person had remarried, and it doesn't impact anyone else on the record. Just like to add that, because everyone's situation is different, and people often wonder if someone else on the record will impact their benefits, and it won't. Okay, so I'll do a quick pause and go right into Medicare. So Medicare, there are 4 parts. Most people are pretty familiar with it, but I'll just go through. Your hospital Part A is the free. It's generally the most, we encourage everyone, if you're entitled to it, to go ahead and sign up. It's free. This is based upon when you're 65 years old. The Part B is where you can have you can decide whether or not it's the best fit for you. Depending on your employer, you may want to check with your employer, because they may say, we want you to have Medicare. If you're eligible, you need to get Medicare as your primary, and then you can have some other supplemental insurance. Sometimes they want you to do that. Others, you can keep your primary until you switch. But it's important to know that because there is a premium with Part B. And I'll talk about those premiums. And there's also a penalty if you don't enroll when you're first eligible. So Part C is a Medicare Advantage, about like HMO. I heard you guys talk about Kaiser, so that's a great example of a Part C, which basically you get coverage for hospital, doctor, and prescription drugs all in one. And then Part D is where you can have just the prescription drug coverage on its own. And we'll talk about this a lot. This basic general eligibility is that you're 65. There's some other health issues that if you have those, you're automatically entitled to kidney failure, ALS. And then also I mentioned earlier a little bit about Social Security disability. If anyone were to, while they're working, have a disability that prevents them from working for at least a year, they are eligible for disability benefits. If you're receiving those benefits for 2 years, you become eligible for Medicare as well. So those are the basic eligibility. But now the enrollment. So magic number is 65. So 3 months before your 65th birthday and 3 months after, you can enroll. It's very easy. You can do it online. You can call. You can go to the office when we're open. We're not open right now. But that's your initial enrollment period. And we really encourage you to 3 months before your 65th birthday and 3 months after. The general enrollment period, let's say for whatever reason you're already working, you don't want to worry about make any healthcare changes, and that's fine. As long as you're working with coverage, you don't need to worry about that. But let's say, hey, I'm about to stop. The general enrollment period is always every January 1st through March 31st. But then also there's a special enrollment period based upon your life change. So, ending a job, or if your spouse, if you're on a spouse's record and you're receiving health care, you may change. You have within 9 months within that period of time of whatever transition to then go and enroll in Medicare. There's a lot of forms that you would need to share to make sure that we know that, let's say you've done this after 65, you could be 70 years old and decide, you know what, I'm going to do Medicare now. Well, it's important to have that paperwork, because for every year that you were eligible and you didn't enroll, there's a 10% penalty that we charge on top of on the premium. And so you want to be aware of that. So I mentioned the premiums. Here are all the list of the premiums, a lot of numbers on this page. I apologize for that. So standard Part B premium is the main one that most of you may already know about, is the $144.60. That's what the standard premium is for Part B right now. And we manage that through Social Security. So if you're receiving benefits, we just automatically deduct that from your record. Some people will get the Medicare only and they won't take their Social Security benefits out. We can manage that too. And you can even pay directly through us or through Medicare. There are multiple ways to handle the payment. If you're a high earner, as you see here, that $144.60 is for those who are making $87,000 or less. If you're making higher than that, there's an amount that you would add on to the standard premium. So first, for those making $87,000 to $109,000, there's an additional $57.80. If you're making between $109,000 and $136,000 a year, there's an additional $144.60, and then that goes. You can see how it continues up. There's an additional $231 or $300 literally up to $347 if you're at that earnings limit. And what they do is look at your modified adjusted gross income. And so you'd pay the premium, the $144 plus whatever amount is here. And it's hard for me to see on the slides here the exact numbers, but it's the same for Part D. The premiums plus that extra amount.
Mm.
based upon your income. So it is income based. And so I like to remind people of that because you don't often think of what the premiums amount, and how that can impact your benefit amount because it's coming out of their payment. And more information for Medicare, I think I sent a link. Hopefully you have access to those links that I sent. There is a really great publication that shows the difference of when you should call Social Security for an issue and when you should call Medicare. I'll admit it's sometimes really muddled, and it's not clear which organization handles what. Well, Social Security, we handle the enrollment, we can send you a new card, we can do all of those things online. We manage the payments. If you choose B or D, we handle all the payment. But the day-to-day kind of questions that Medicare has to do with is more of what services are provided. And so they're better for that. I'm pretty much at the close. I just want to show a little bit of how to reach us. I talk a lot about online. There is ways to contact us is, you can put your zip code in and it'll pull up whatever office. Even though our offices are closed, by doing this, it'll give you the local number to the office, which we've been promoting that now since the offices are closed. So in addition to the 800 number where you can call our national 800 line, you can put in your zip code and whatever is your closest local office. If you type that in, this will pull up that local number. And it's depending on how busy those offices are, but generally the manager is following up and reaching out to people because we are closed. I mean, we're closed for face-to-face. But I've stressed that there's so many things that you can do online. You can apply for Social Security, as we've talked about, and then you can monitor the status. You can see what's going on. You can get replacements. Once you're receiving benefits, you can get your 1099. You can get the replacement card there now. But it does take a little bit of work to first get the account. It does ask you some what we call out of the wallet questions, and they're based upon like your credit record, and sometimes that's really challenge, I'll admit, because it's a lot of people talk about how hard it is, but that's on purpose. That's so that no one else can access your account. So we put in the security features to make sure that we're protecting your information. And then this is just kind of a screenshot of what you'll see on the website. And I like to highlight the four. There's the My Social Security underneath the pictures. There's a kind of 4 circles. About it a lot, but it's important that all your names match up. A lot of time what holds up anything on our end, if that the name and our records don't match, if you had a life change, if you changed your name, if you've used one name for your whole life, but you never changed it in Social Security records, those things won't line up. And you have to go through the process to update your number that it matches with your name. The retirement estimators where you would then follow and you can pull your own earnings information, and then our frequently asked questions. And then we also have a lot of information in multiple languages. So I encourage you to share this with others because people don't always realize that we have a lot of our main publications published in other languages, and people really want to spend time figuring out their retirement plans in the future so they can, and sometimes you want to read it in your own language. And that's it.